everyone, my name is Olivia Chusey, and today I will be presenting on youth and young adult mental health. This topic is incredibly important because we're seeing a concerning rise in rates of depression, anxiety, and suicidal ideation among adolescents and young adults over the past decade. Unfortunately, even though this age group is at higher risk, many young people do not receive the care they need. Throughout this presentation, we'll explore the unique barriers youth face, including stigma, limited access to care, and the lack of mental health resources in schools and communities. I will also discuss the long-term consequences of untreated mental health challenges, both for individuals and for the broader community. Finally, we will review evidence-based, culturally responsive interventions and comprehensive strategies designed to mitigate these disparities, ultimately aiming to improve outcomes and provide meaningful support for young people. By the end of this presentation, I hope to provide insights that highlight why this issue matters and how we, as a community and as professionals, can take action to address it. In recent years, we've seen increasing rates of depression, anxiety, and suicidal ideation among youth and young adults. These rising numbers are alarming and reflect a broader trend in mental health challenges for this age group, highlighting a growing need for awareness and intervention. Youth face unique barriers when it comes to accessing mental health care, including stigma, limited access to providers, and a lack of resources in schools and communities. Stigma alone can prevent young people from seeking help, as they may fear being judged or misunderstood by their peers, family, or educators. These barriers are compounded by systemic issues such as poverty, limited insurance coverage, and the scarcity of culturally competent services. The long-term consequences of untreated mental health issues are significant, affecting not only the individual, but also families and communities. For example, untreated depression and anxiety can impact school performance, strain family relationships, and reduce participation in community activities, which in turn perpetuates cycles of stress and disadvantage. Addressing these challenges requires culturally responsive interventions that respect and integrate the diverse backgrounds, experiences, and needs of youth. By focusing on comprehensive strategies for mitigation, including early identification, accessible treatment options, and community engagement, we can work toward reducing these mental health disparities and supporting healthier outcomes for youth across different populations. This slide sets the foundation for understanding why a multifaceted, culturally informed approach is essential to truly address these challenges. Mental health challenges in youth don't just affect the individual. They have widespread implications for academic achievement, social development, and family dynamics. Poor mental health can make it difficult for students to focus in class, complete assignments, and perform at their full potential, which can have long-lasting effects on their educational trajectory. Socially, it can impact relationships with peers, teachers, and family members, leading to feelings of isolation, misunderstandings, or conflict at home and school. At the community level, when a significant number of young people are struggling, we see effects like absenteeism, reduced engagement in extracurricular activities, and a lack of participation in community programs. Importantly, underserved populations often feel these impacts more strongly because they have fewer resources to rely on and may face additional systemic barriers to mental health support. Early intervention is critical because addressing mental health challenges as soon as possible can prevent more severe, long-term issues and improve overall well-being. During this presentation, we will look at strategies that target not only individual needs, but also systemic changes to ensure that youth can access the support they need to thrive academically, socially, and emotionally. Looking at the statistics, we can see just how severe the mental health challenges are for youth today. Over 40% of high school students reported feeling persistently sad or hopeless in 2021, according to the CDC. That is nearly half of all students, which signals a critical need for awareness and intervention. Additionally, nearly 1 in 3 students experienced poor mental health, indicating that these issues are widespread rather than isolated. Over the past decade, rates of anxiety and depression among adolescents and young adults have steadily increased, highlighting the ongoing nature of this crisis. Alongside these trends, suicidal ideation and attempts are also on the rise, which is deeply concerning and underscores the urgent need for prevention and early support programs. Research shows that these mental health challenges disproportionately affect low-income youth and those from minority backgrounds, revealing stark health disparities and inequities in access to care. This data emphasizes the importance of targeted interventions that reach the youth who are most vulnerable, ensuring that prevention, treatment, and support services are accessible and effective. Understanding the scale and distribution of these mental health issues allows policymakers, educators, and healthcare providers to design comprehensive strategies that address the unique challenges faced by these populations, ultimately aiming to improve both individual and community outcomes. When we look at the environmental and social risk factors that contribute to youth mental health disparities, several key elements stand out. Youth living in rural or under-resourced communities can face significant barriers to accessing care, including fewer mental health providers, long travel distances, and limited school-based services. Unsafe school environments and neighborhood stressors, such as violence, lack of recreational spaces, or poor infrastructure, can further exacerbate stress and negatively impact mental health. Peer influence and the pressures of social media also play a critical role, as adolescents compare themselves to idealized images online or experience cyberbullying, which can increase anxiety and depression. Family instability, including parental stress, unemployment, or conflict at home, adds another layer of risk for young people, as children often internalize these stressors, which can affect both emotional and behavioral health. Cultural beliefs and stigma around mental health create additional barriers, particularly in communities where seeking help is seen as a weakness or where mental health is not openly discussed. All of these factors interact in complex ways, making it clear that youth mental health disparities are not caused by a single issue, but rather a combination of social, environmental, and cultural influences. Understanding these interconnected risk factors is critical for designing interventions that are comprehensive, culturally responsive, and accessible to the youth who need them most. Structural barriers to care are one of the most significant contributors to disparities in youth mental health. One of the major challenges is the shortage of mental health professionals, especially in rural or underserved areas. Many communities simply do not have enough licensed counselors, psychologists, or psychiatrists to meet the growing demand for services, which leaves many young people without the support they need. Another critical barrier is the high cost of care combined with inadequate insurance coverage. Even when services exist, many families cannot afford therapy or medication, which limits treatment options and perpetuates mental health inequities. Limited school-based programs and counseling availability also present a challenge. Schools are often the primary point of contact for youth mental health support, but many schools lack the resources, staff, or funding to provide consistent and accessible mental health services. Transportation and logistical challenges further complicate access, particularly in rural communities where traveling to appointments can be time-consuming or expensive. Finally, insufficient funding for community mental health programs means that preventative and supportive initiatives are often underdeveloped or non-existent, leaving youth with few options outside of emergency care. Together, these structural barriers create a system where access to mental health care is uneven and inequitable, emphasizing the need for targeted strategies to remove these obstacles and improve outcomes for all youth. Socioeconomic and environmental factors play a major role in shaping youth mental health outcomes. Low socioeconomic status, including poverty, housing instability, and food insecurity, directly impacts a young person's emotional and behavioral well-being. Youth growing up in these conditions often face chronic stress and uncertainty, which can increase vulnerability to depression and anxiety. Family dynamics also matter significantly. Parental stress, mental health challenges, and strained family relationships can contribute to emotional difficulties in children and adolescents, often creating a cycle of stress and poor coping mechanisms. Neighborhood factors such as exposure to violence or a lack of safe spaces for recreation further exacerbate these risks. When communities do not provide safe environments for children to learn, play, and socialize, youth are more likely to experience behavioral health issues. Peer influence and social media pressures also impact mental health. Adolescents today are constantly comparing themselves to others online, which can increase feelings of inadequacy, anxiety, and depression. Cultural and behavioral factors also influence whether youth seek help. Stigma around mental health, cultural beliefs about self-reliance, and a lack of knowledge about available resources can prevent young people from accessing the support they need. When combined, these socioeconomic and environmental challenges create a complex web of risk factors that can make it critical for interventions to address both individual and systemic barriers to care. To address youth mental health disparities, we must focus on policy and program solutions that target structural barriers to care. Many communities face systemic challenges, including a shortage of mental health professionals, limited funding for programs, and logistical issues such as transportation, which prevent youth from accessing services. School-based mental health programs have proven effective in bridging some of these gaps. By placing counselors, social workers, and psychologists directly in schools, we can provide early identification, counseling, and support services for students who might otherwise go untreated. Another key solution is improving insurance coverage and financial access. Many families cannot afford private mental health care, so expanding coverage and reducing out-of-pocket costs ensures that youth from all socioeconomic backgrounds can access the care they need. Telehealth expansion is also critical, especially for rural and underserved communities. Virtual mental health services allow students to receive therapy and counseling remotely, reducing transportation challenges and providing greater flexibility in scheduling. Finally, community awareness and outreach efforts are essential. Educating parents, teachers, and youth about mental health resources, reducing stigma, and promoting early help-seeking behaviors can encourage engagement and prevent long-term consequences of untreated mental health issues. Combining these structural, programmatic, and policy-level interventions creates a comprehensive framework to reduce disparities and promote equitable access to mental health care for all youth. Early identification of at-risk youth is one of the most important steps in addressing behavioral health disparities. By proactively screening students for signs of depression, anxiety, or suicidal ideation, schools and communities can intervene before these issues escalate into crises. On-site counseling and therapy within schools provide immediate access to mental health professionals, helping students receive care in a familiar and supportive environment without the need for travel or additional appointments. Group and peer support programs are also highly effective, giving students the opportunity to connect with others who share similar experiences and reducing feelings of isolation. Teacher and staff training ensures that educators can recognize warning signs, respond appropriately, and refer students to the necessary resources. This training fosters a more supportive school environment and encourages collaboration between educators and mental health professionals. Early intervention not only reduces stigma, but also improves student engagement, attendance, and overall well-being. When combined, these strategies create a comprehensive approach that helps youth access care quickly, feel supported, and develop the coping skills necessary for long-term success. Telehealth solutions have become a crucial way to increase access to mental health care, particularly for youth living in rural or isolated communities who may face significant barriers to in-person services. By offering virtual appointments, telehealth eliminates many geographic and transportation challenges, allowing students to connect with licensed mental health professionals from their homes or local community centers. Flexible scheduling is another advantage, giving families the ability to access care outside of traditional work or school hours, which reduces missed appointments and ensures more consistent treatment. Telehealth also provides confidential services, which is particularly important for adolescents who may be hesitant to seek help due to stigma or cultural concerns about mental health. Integration of telehealth with schools and community centers ensures that care is accessible in trusted environments, helping to bridge the gap between academic, social, and emotional support systems. Additionally, telehealth is a cost-effective alternative to traditional in-person therapy, reducing financial burdens on families and communities while still providing high-quality care. Overall, telehealth solutions expand access, improve engagement, and allow mental health services to reach youth who might otherwise go without care, creating a more equitable system for all students. Peer support networks are an essential component of addressing youth mental health, as they provide opportunities for young people to connect with others who share similar experiences, which can help reduce stigma and encourage help-seeking behaviors. These networks give students a safe space to talk openly about their challenges and offer mutual encouragement, which is particularly effective for adolescents who may feel isolated or misunderstood. Outreach programs targeting underserved communities are equally important, as they actively bring mental health resources to populations that may have limited access due to geographic, financial, or cultural barriers. Ensuring that these initiatives are culturally responsive allows care to be tailored to the specific beliefs, values, and experiences of the youth being served, which improves engagement and outcomes. Collaboration with local organizations, such as schools, faith-based institutions, and community centers, helps to strengthen these support networks by creating trusted points of contact, where youth and families can access resources more easily. Engagement in preventative and educational initiatives further reinforces these efforts, teaching students, families, and communities about mental health, coping strategies, and available supports, which fosters a proactive rather than reactive approach to behavioral health. Altogether, peer support and community outreach create a comprehensive system that normalizes mental health care, reduces stigma, and ensures that all youth, especially those in underserved populations, can access the resources they need to thrive. To effectively address youth mental health disparities, policy recommendations and advocacy efforts must target multiple levels of the system. Expanding school-based programs by increasing the number of counselors is a critical step, as this provides direct, accessible mental health support within the school environment, which is where students spend much of their time and can be most easily reached. Improving insurance coverage for youth mental health services ensures that all families, regardless of income, can access necessary care without facing financial hardship, which is particularly important for low-income or underserved populations. Launching culturally responsive awareness campaigns is another key strategy, as it helps normalize mental health discussion and educates students, families, and communities about recognizing symptoms, accessing resources, and reducing stigma associated with seeking help. Telehealth programs for rural and isolated communities further enhance accessibility by overcoming geographic barriers, providing flexible scheduling, and offering confidential care that can be culturally sensitive and integrated with local schools and community centers. Finally, integrating interdisciplinary collaboration across schools, families, and healthcare providers allows for a holistic approach, ensuring consistent communication, shared accountability, and coordinated care, which is essential for addressing the complex factors that contribute to youth mental health challenges. These combined policy and advocacy efforts create a supportive, equitable, and sustainable framework for improving behavioral health outcomes for young people. Interdisciplinary collaboration is essential to effectively address youth mental health disparities. By bringing together schools, families, healthcare providers, and community organizations, we create a network of support that can address the multiple influences on a young person's mental health. Coordinated identification, referral, and treatment ensures that students who are struggling are recognized early, connected with appropriate services, and monitored over time, which improves outcomes and reduces the likelihood of issues escalating. Holistic support considers academic, social, and emotional factors, recognizing that mental health does not exist in isolation, and that students thrive when all aspects of their development are supported. Culturally sensitive approaches are critical because they improve engagement and trust with students and families, particularly those from underserved or marginalized communities who may face stigma or distrust of traditional healthcare systems. Ongoing communication and feedback loops between all stakeholders allow for continuous monitoring, adaptation of intervention, and sharing of insights to improve care quality and responsiveness to student needs. Overall, interdisciplinary collaboration not only strengthens the support system for youth, but also fosters a more inclusive, responsive, and effective approach to mental health care. Implementation of comprehensive mental health strategies for youth is expected to yield significant outcomes across multiple areas. First, increased access to mental health services ensures that more students can receive the care they need, particularly those in rural or underserved communities who may otherwise go without support. With greater access and early intervention, we anticipate reduced rates of untreated depression and anxiety, helping young people manage symptoms before they escalate into more severe conditions. Another critical outcome is the decrease in suicidal ideation and attempts, as timely and effective interventions provide coping tools and support systems for students in crisis. Improved academic performance and engagement are also expected because mental health support directly impacts students' focus, attendance, and overall ability to participate in school. Beyond individual benefits, these interventions enhance family and community well-being by reducing stress on caregivers, fostering healthier family dynamics, and promoting a culture of mental health awareness and support within communities. Overall, these expected outcomes not only address immediate behavioral health needs, but also contribute to long-term societal benefits, highlighting the importance of investing in youth mental health initiatives. To assess the effectiveness of the comprehensive mental health strategies, we must carefully track several key evaluation metrics. First, service utilization rates will be monitored to determine whether more youth are accessing mental health services as a result of the interventions, which is a critical measure of reach and engagement. Student mental health screenings and follow-ups provide data on early identification and ongoing support, ensuring that at-risk youth are receiving consistent care and that interventions are meeting their needs. Academic performance and attendance records will also be examined, as improvements in mental health should correlate with better school engagement and success, reflecting the broader impact of these programs. Family satisfaction and engagement surveys offer insights into the perceived value and accessibility of the services provided, highlighting whether families feel supported and informed throughout the process. Finally, program adaptability and continuous improvement are essential to ensure interventions remain effective over time, incorporating feedback involving evolving needs and new evidence-based practices. Together, these evaluation metrics will allow for a holistic understanding of program impact, guiding further improvements and ensuring that strategies meaningfully reduce disparities in youth mental health. To reduce youth mental health disparities, several key policy recommendations must be prioritized. First, increasing federal and state funding for school-based mental health services is essential to provide adequate staffing, resources, and programs directly within the environments where youth spend most of their time. Expanding insurance coverage for youth mental health treatment ensures that financial barriers do not prevent access to therapy, counseling, or psychiatric care, especially for low-income families. Supporting culturally responsive, evidence-based programs is critical, as these interventions are more likely to engage diverse populations and respect cultural differences while addressing mental health needs effectively. Additionally, incentivizing the training and retention of mental health professionals in underserved areas addresses the critical shortage of providers and ensures that students in rural or under-resourced communities receive the care they need. Finally, mandating regular mental health screenings in schools allows for early identification of at-risk youth, enabling timely interventions and preventing long-term mental health challenges. These combined policies create a comprehensive approach that targets structural, cultural, and financial barriers to youth mental health care, supporting healthier outcomes for students, families, and communities. To make a meaningful impact on youth mental health, engagement and advocacy are crucial. First, we must actively engage schools, healthcare providers, and policymakers to create a coordinated and supportive system for students. Advocating for expanded mental health services ensures that resources, programs, and trained professionals are available to all youth, particularly in underserved communities. Reducing stigma and normalizing help-seeking behaviors is essential so that students feel comfortable accessing mental health support without fear or shame. Promoting interdisciplinary collaboration across educators, counselors, healthcare professionals, and community organizations allows for holistic support and better outcomes for youth. Finally, committing to data-driven evaluation and continuous improvement ensures that programs remain effective, adaptable, and responsive to the changing needs of youth and their families. By taking these steps, we can collectively create a culture that values mental health, removes barriers to care, and empowers young people to thrive academically, socially, and emotionally. On this slide, I have included all the sources that were used to develop this presentation and support the data, strategies, and recommendations I've shared. These references include peer-reviewed research, government reports, and reputable mental health organizations, which provide reliable and evidence-based information. For example, the data from the CDC was critical in highlighting the prevalence of depression, anxiety, and suicidal ideation among youth, as well as environmental and structural barriers to care. The National Alliance on Mental Illness provided insight into peer support networks, stigma reduction strategies, and effective outreach programs. Research by Braveman, Eggerter, and Williams offered important context to socioeconomic factors and health disparities impacting mental health outcomes. Additional sources, including Zimmerman and Anderson, Jackson, Smith, and Lee, Cobb, Jaycox, and Wainwright, and the World Health Organization, helped inform recommendations for culturally responsive care, telehealth, and interdisciplinary collaboration. Finally, the guidance from the U.S. Department of Health and Human Services and Williams and Cooper contributed to policy recommendations and advocacy strategies. Together, these references ensure that the information and interventions presented are grounded in current research, best practices, and actionable evidence. By relying on credible resources, we can confidently advocate for meaningful change and improve mental health outcomes for youth and young adults. This concludes my presentation on addressing youth and young adult mental health disparities. As we've discussed throughout these slides, mental health challenges such as depression, anxiety, and suicidal ideation are on the rise, particularly among underserved population. We explored the structural, environmental, social, and cultural barriers that prevent youth from accessing care, and we highlighted evidence-based solutions, including school-based programs, telehealth, early intervention, peer support, and interdisciplinary collaboration. Implementing these strategies requires the coordinated efforts of schools, healthcare providers, families, policymakers, and community organizations. Most importantly, change is possible, but it requires all of us to take action, raising awareness, reducing stigma, advocating for policy improvements, and ensuring culturally responsive care is accessible to every young person in need. By working together and combining our efforts, we can make a real difference in the lives of youth struggling with mental health challenges. So I leave you with this call to action. Together, we can close the gap. This phrase reflects our collective responsibility and the hope that through collaboration, informed advocacy, and dedication to evidence-based strategies, we can reduce disparities, improve outcomes, and create healthier, more supportive communities for all youth. Remember, closing the gap in mental health access is not just a professional goal. It's a societal commitment that benefits families, communities, and future generations. Thank you.